What makes a good doctor? It's a question that might seem simple, but the answer is far from it. As we journey through this discussion, we invite you to consider the complex and multifaceted nature of this role. A doctor isn't merely a dispenser of medication or a surgeon's skilled hand. They are confidants, counselors, educators, and at times lifesavers. Today, we will explore 7 crucial habits that set apart good doctors from the rest. These habits range from active listening, empathy, and constant learning to excellent communication skills, professionalism, adaptability, and patience. Each of these habits, while seemingly simple, plays a significant role in shaping the doctor-patient relationship, contributing to the overall quality of healthcare and ultimately, patient outcomes. So, as we delve into the details of what makes a good doctor, we invite you to reflect on your healthcare experiences. As we delve into these habits, ask yourself, how many of these does your healthcare provider possess? The first habit of a good doctor is active listening. Now, active listening is not just about hearing what the patient says, it's about tuning into their emotions, understanding their concerns, and interpreting their nonverbal cues. This skill is crucial in medical practice. It allows doctors to grasp the full context of a patient's health, capturing crucial information that may be missed otherwise. Active listening also fosters a sense of trust and respect between the doctor and the patient. It assures patients that their doctor genuinely cares about their well-being, making them more likely to follow medical advice. Good doctors apply this skill by maintaining eye contact, nodding to show understanding, and refraining from interrupting. They ask thoughtful questions to clarify and confirm their understanding. So, the essence of active listening in medicine is not just about diagnosing the disease, but understanding the person who has the disease. Remember, a good doctor should listen more than they speak. Empathy, our second habit, is vital in the medical field. Empathy goes beyond mere sympathy. It's about understanding someone else's situation from their perspective. In the realm of healthcare, empathy forms the backbone of a strong patient-doctor relationship. It's not just about diagnosing a condition or prescribing a treatment, but about truly understanding the patient's feelings, fears, and anxieties. By showing empathy, doctors can create a safe space for patients to express their concerns, boosting their trust and confidence. It enhances the patient's willingness to follow through with treatments and fosters better patient compliance. Furthermore, empathy can positively affect patient outcomes. Research has shown that patients who feel their doctors understand them have lower levels of stress, which can aid in recovery. Empathy doesn't stop at understanding, it also involves showing that understanding to the patient, making them feel seen, heard, and valued. Empathy is not just about understanding, but also about showing that understanding to the patient. Our third habit can be summed up in 2 words: constant learning. Now, we're not talking about the kind of learning that ends with a diploma or a degree. We're talking about a lifelong commitment to expanding one's knowledge base and skill set. In the ever-evolving field of medicine, new research is being published every day, innovative treatments are being developed, and our understanding of diseases is constantly improving. A good doctor doesn't rest on their laurels or rely solely on what they learned in medical school. They stay updated with the latest advancements and continuously educate themselves. This habit of constant learning allows them to provide the best possible care to their patients. It enables them to diagnose accurately, recommend the most effective treatments, and stay ahead of the curve in their field. A good doctor always has their finger on the pulse of new medical knowledge. Medicine is constantly evolving and a good doctor evolves with it. The fourth habit of a good doctor is having excellent communication skills. It's not just about conveying information, but also about translating complex medical jargon into something that's easily digestible. Imagine being a patient, anxious and uncertain, and your doctor bombards you with terms like hematoma or angina. It's overwhelming, isn't it? This is where good communication comes into play. A good doctor knows how to break down these complicated terms and procedures into plain English. They guide their patients through the labyrinth of medical terminology, bringing clarity to the chaos. They don't just talk, they ensure their patients understand. They understand that good communication is a two-way street. They listen, they clarify, they explain. They provide a comforting presence amidst the fear of the unknown. They make sure their patient's journey through the medical process is as smooth and understandable as possible. Good communication can be the difference between understanding and confusion. After all, isn't understanding the first step towards healing? The fifth habit of a good doctor is professionalism. But what does professionalism in healthcare look like? Let's delve into that. First, Punctuality is a fundamental aspect. It's about respecting other people's time, be it your colleagues or your patients. Arriving on time for appointments and meetings not only demonstrates respect, but also allows you to manage your tasks effectively. Another key aspect is respect towards everyone you interact with, patients and colleagues alike. This includes recognizing diversity, promoting inclusivity, and maintaining a positive and supportive attitude. Last but certainly not least is maintaining patient confidentiality. It's a non-negotiable duty that ensures the privacy and dignity of patients. It's about safeguarding personal and medical information, a practice that builds trust and fosters open communication. These elements are not just about ticking boxes in a professional conduct checklist. They're about creating a culture of respect, trust, and reliability. Remember, professionalism is the cornerstone of trust in the patient-doctor relationship. Adaptability, our sixth habit, is key in the dynamic world of healthcare. Just as water molds itself to the shape of its container, a good doctor must be able to adapt to the ever-changing landscape of their profession. From new technologies that revolutionize treatment plans, to fresh research that upends long-held beliefs, the realm of healthcare is in a constant state of flux. Being adaptable doesn't just mean keeping up with these changes, it means embracing them wholeheartedly. It's about learning to use new tools, understanding the latest research, and applying these advancements to patient care. It's about recognizing that what worked yesterday might not work today, and what works today might not work tomorrow. Adaptability leads to better patient care because it ensures that doctors are always using the most up-to-date practices and treatments. It keeps them on their toes, always learning, always improving. In the face of change, a good doctor adapts. Our final habit of a good doctor is patience. In the hustle and bustle of the healthcare world, patience can often seem like a luxury rather than a necessity. However, it is an essential trait for every good doctor. Patience allows doctors to spend the necessary time with each patient, listening to their concerns and explaining their condition and treatment options. This not only builds trust, but also ensures that patients feel heard and understood, which can greatly improve their overall healthcare experience. Moreover, patience is critical when waiting for test results. Jumping to conclusions without all the information can lead to incorrect diagnoses and inappropriate treatments. By exercising patience, doctors can make more informed decisions that are in the best interests of their patients. Additionally, patience can help alleviate stress, prevent burnout, and promote a more positive work environment, all of which can contribute to better patient care. Patience can often be the key to unlocking the best healthcare outcomes. So these are the 7 habits of a good doctor. Over the course of this video, we've taken a deep dive into what shapes a good doctor. It's been quite a journey, hasn't it? Let's quickly recap what we've learned. Our first stop was active listening. A doctor's ability to carefully take in what a patient is saying is crucial. It's about more than just the words spoken. It's about understanding the emotions, the fears, and the hopes that come with them. Next, we talked about empathy. This is the capacity to step into another's shoes, to feel their pain and joy. Empathy helps a doctor connect on a deeper level with their patients, fostering trust and encouraging open communication. Our third habit was constant learning. Medicine is an ever-evolving field. A good doctor knows that their education doesn't stop once they leave medical school. They remain eager to learn, to grow, and to adapt to new advancements or techniques in healthcare. Then we looked at communication skills. Being able to effectively convey information to patients, their families, and other healthcare professionals is key. It helps reduce misunderstandings, eases fears, and ensures everyone is on the same page about a patient's treatment plan. We also discussed professionalism. This covers respect for patients, ethical behavior, and maintaining a healthy work-life balance. It's about setting the right example and living up to the high standards set by the medical profession. Adaptability was our 6th habit. The ability to think on one's feet, to adjust to unexpected situations or new information, is invaluable in the fast-paced world of healthcare. It's about being flexible without compromising on quality of care. And finally, patience. A good doctor knows that healing takes time. They understand that each patient is unique, and so is their journey to health. Each of these habits contributes to a doctor's ability to provide quality healthcare. They shape them, not just as professionals, but as compassionate human beings dedicated to the well-being of others. The next time you interact with a healthcare professional, keep these habits in mind. They might just help you determine what makes a good doctor.